and welcome back to the Healing Mind podcast. I'm Dr. Michelle Graydon, and today we're going to be talking about the therapeutic relationship. We touched a little bit on this last time, and I think I did talk about a couple of the things that you need to have. But when we look at your relationship with a therapist, it's huge. I mean, what makes it so essential is that you have to feel comfortable. You have to be in a place where you feel like you're being heard and that you have some sense of trust. And this is kind of what I was talking about before, was if you don't feel that connection with a therapist, it's going to be very hard for you to share and very hard for you to feel like, you are getting what you want. So I think part of the therapist bond is really getting that connectivity with somebody. And you should know pretty quickly if you kind of mesh with this person or not. And when you think about the therapeutic alliance, it's really the relationship of you working with the practitioner. But that's built on trust, empathy, and collaboration. If you're not feeling an empathic response set from your therapist, it's going to be very hard for you to then sit there and take in information. Because if you think about it, if you're feeling anything like judgmental or that the therapist is imposing their ideas, I mean, that's not what psychotherapy is. No matter what I feel about a situation personally, that has nothing to do with how I help you in your brain deal with the things that you need to deal with. Those are two separate issues. So boundaries are hugely important. A friend of mine was just telling me actually the other day that she's going to stop therapy. And I said, well, what's going on? And she said, I feel like my therapist is like my best friend now. And she kind of smiled. And I said, yeah, because the therapeutic boundary wasn't put up. My relationship with you is not to be your friend. We have a lot of friends in our life. You're paying me because I have a PhD and I know what I'm talking about, number one. But number two is you don't need friends for a therapist. You need somebody that's completely objective, that can look at all of the things you're saying, understand those, and work with you to get that good result of figuring out what's going on in your core. How can we release it? How can we take away what doesn't serve us anymore? And then more importantly, how can we heal and move forward? Because part of it's, dealing with your core. And then the other part is, okay, well, how do I keep myself static? How do I keep myself in this place where, again, I'm going down my lazy river? That's where I want to be. My goal is to be in the lazy river. I want to eliminate my hamster wheel. What do I need to do to get there? And how much of a relationship you have with your therapist is really hugely predictive statistically in how well you're going to do and positive outcomes of treatment. It's not really as much as the therapist modalities they're using, whether it's CBT or DBT or like an eclectic approach with traditional psychotherapy and figuring out your core and then moving into your healing therapies on the way that those can help you to continue to feel good every day without having to see a therapist every week. You're your own therapist. And that's kind of my goal for everybody, is to figure that out, figure out what they need, how they want it to be done, and move forward from that. But, I think the most important thing is you need to feel that openness with your therapist. You also need to be vulnerable. And I talked about this, I think, in last week's podcast, is that you have to feel that this is a place where it's not judgmental and it's motivating you to grow and to change and supporting the neuroplasticity, because that's huge. Trust, emotional safety, and allowing your brain to rewire all those negative thought patterns, because that's what's going on. That's where, you really need to understand how that works. It's just that you, by gratitude, by positive affirmations, by all of that is what allows you to move forward and get through all of these things. And if you have that strong therapeutic bond, clearly it enhances all of the treatment effectiveness because you're more motivated. If you have somebody that you're feeling, I don't think he or she gets me. I don't think they understand where I'm coming from. I feel like I'm being judged on what I'm saying, because this needs to be an open forum for you. This is not a friend relationship. Again, it's a doctor-patient relationship. You have to have professional boundaries. I have to have professional boundaries. And so those boundaries then lead into our dynamics of our psychotherapeutic relationship. And that's why it has to be very well laid out initially. And if you get the feel, that your therapist is sharing things about their life, that's kind of a red flag, because it doesn't matter what's going on in my life. It doesn't matter what I've experienced in my life. It matters what you think. It matters what you feel. And it matters how I can help you feel better and get into your lazy river. So I think that's really the most important part of that. And, to really feel like you've truly being heard, like somebody is actually really listening to what you're saying and acknowledging what you're saying and giving you feedback on what you're saying and also clarifying. There's a lot of that in therapy, and sometimes they make jokes about it in movies, but the reality is, this is what I heard you say to me. So you get to hear a reflective response to what I'm hearing you say, because maybe I'm missing something. Maybe I didn't hear it correctly. So that is the part of a great therapeutic relationship where you have that ability and you feel like that, your therapist is really listening to you and trying to make the connections, because when I'm listening to you, I'm making connections in my head and I'm kind of keeping, okay, well, maybe this goes with that, and maybe that's why that and this and that. But, that is part of the process for me, at least when I'm doing psychotherapy, because I think it's important for me to kind of keep it's kind of like, in my head, you have the nucleus and then you have all of the things around. So I'm going, okay, does that tie into that? Does that tie into that? And try and make those connections that most of us don't really understand until they've been through psychotherapy. I had a fantastic psychologist, because I had to do that for school for 2 years. And she helped me greatly get through all of the things that I was trying to get through at the time. And then, when I started my Reiki and my healing therapies, all new stuff came up. So even though I thought I cognitively dealt with all of my issues, my body was still holding on to these things. And that's the importance to me. And that's how I merged these two as being the catalyst for significant change and for now neuronal change, and then keeping that neuronal change there. So I think that's hugely important. Again, I just touched upon it, the active listening, truly hearing and reflecting back what you say to me. So you have an idea of what other people are hearing by what you say. Maybe there's something else with body language. Maybe there's something there that, you're saying, yeah, I'm fine. No, I'm super happy. Okay, well, I'm not feeling that. And I'm not really seeing that. Your posture, your hands are clenched, and kind of giving somebody that type of feedback in a safe place where you're not feeling judged, but you are feeling that somebody is seeing you, and, what impact does that mean to you? What can you do to change that? Or do you want to change that? There are some things that, maybe you're not willing to change about yourself, and that's fine. Then we go around and try and figure out other ways to get you into your lazy river. And I think the other part of a therapeutic relationship is really having genuineness and authenticity. You have to feel connected. You have to feel like this is a therapeutic space where you're safe, but you're being listened to from a therapeutic standpoint, not like a friend or not like anybody else. Realizing and recognizing that really that part of it is the best part of it. Because your friends are what? They'll tell you whatever you want to hear. But a real friend doesn't tell you everything you want to hear. They tell you what they perceive. And again, another important factor is, even in psychotherapy, I'm not dealing with the truth. There is no such thing as the truth. I'm dealing with your perception of the truth. I don't know what happened in any of the circumstances that you relate to me. What I do know is how you interpreted that. I don't know if that's right or wrong. There is no right or wrong, right? But what we have to ferret out then is your feelings towards that and what was transpiring with you when those things happen. So I think, that's a hugely important. And then really recognizing and respecting everybody's diverse background. You can't take somebody that has a completely cultural, non-Westernized thought process and say, oh, no, you have to do it this way. You have to take people where they are. You have to be having somebody listen to you that is listening to you now from your cultural perspective, because those are huge, right? All the different cultures and all the different ways that we were all raised needs to be addressed, and it needs to be looked at from that cultural perspective and say, okay, so, maybe there's all these things that your culture innately does. And now you're saying, you know what, I don't want to do those things. And I've evolved past them, or I don't think those are valuable. And so that's a huge dichotomy for a lot of people. They want their family, they love their family of origin, but they're just not relating to them in 2025. We're not being given away to marriage, all those things that worked at that time. But you can't look back and say, well, that's not valuable because you feel the way you feel now. You have to figure out all those things that were there, what parts of those you want to keep and what parts of those are making up your thought process. And that's really, super important culturally to figure out, okay, where did you come from? What type of, and that's part of getting to the core, right? And then really feeling like you have a safe space to express yourself. This is really the place where you say those things like, I've never said this before, but this is how I feel. Because that's great. That's the beauty. That's the magic, right? Because you finally get to say those things that you would never say to anybody, but you can say to me or your therapist, because that's the environment we're in. Those are the things we need to process. Those are the things we need to look at. Well, where do you think that came from? Well, what do you think is, what's the catalyst for that? Is that really how you feel? And if it is, then okay, that's how you feel, and kind of really having this openness and this readiness to hear somebody else's perspective and to feel somebody else's perspective, which is what I do, right? I have to be able to kind of get into that space with you and say, I get it. I understand. I know my thoughts and my perspective are 100% based on my culture and being raised, so why would it be different for anybody else? And, again, back to the judgment and reactivity. One of the things we learn in school is really to be non-reactive to what people say, right? Because if you tell me something and then I have to, and I'm like, oh my God, I can't believe she just said that, or he just said that. That's not what people need. And, part of my training and expertise was in neuropsychological assessment. So I did a lot of court hearings for people that wanted to get out of jail and people that wanted to be not deemed insanity. So I would go in there with my husband, who's an MD, forensic psychiatrist, and I was his neuropsychologist that did the testing on the patients just to see what else is going on. But these patients will look at you and tell you exactly what they did. And I was mortified half the time. But my face and my affect was just like, well, you think you were feeling when you chopped his head off? And it's really that, like, you're just in this monotone place where you're like, okay, well, how did you feel about that? What were you thinking at the time of the offense? What maybe was going through your thoughts? And getting that. So it's huge and that's really where I hone that ability. But, that is also where you have to be as a good therapist. You have to be in that headspace where no matter what somebody tells you, you can't be reactive to it. So if you feel like you're with somebody and, they're being like, oh, okay. That's not a healthy mix for you. That's not somebody that's going to be open to help you because they're already deciding what that statement means to them, which is poor professional boundaries. It's not about them, why you say the things you say and how that affects them. It has to be this neutral place where that doesn't affect me. Why would that affect me? That's what's going on in your life. Let me help you in your life heal the things you want to have healed. Let me get you into your lazy river. Let me put you where you need to be so that you're not in your hamster wheel of anxiety and depression and grief and loss and trauma, whatever it is, let's move through that and get you into your lazy river where it's a much better place to be. So I think, those are all really huge points in figuring out a therapist, psychologist, whoever it is to help you get through whatever you're looking at trying to get through. And, what quality do you believe is essential for a therapist? Again, another comments, let me know in your comments. What do you think would be a good quality that you would like? And then understanding, that is a huge part of this. For you to have a good therapeutic relationship and you to have trust in your therapist, that's huge, because if you cannot build that trust, it's going to be very hard for you to let go. And the beauty of psychotherapy is you finally get to let go. You finally get to say all this crap that that you've been living with or dealing with, and you dump it onto me. That's how therapy works. Yay. But you have to understand that it is not an instant thing. It's not Instagram. It's not, where you can fix it in a 5-minute reel. But you do have to get your trust. Be proactive in your therapeutic session. If something doesn't work or something isn't happening, then you say that. This is your money. This is your space. This is your time. You control it. And that, again, is part of the beauty, right? And part of my journals that I have my patients work through are very effective for this, because you now have a daily notes, daily records. Because when you come in once a week, what happens? Well, what happened last week? I don't know. I can't even remember yesterday's dinner or if I had dinner. So by the act of writing it down, you're doing so many things, but you're obviously activating your reticular activating system, and you're releasing what doesn't serve you. You're putting out into the universe because you've already written it down. And there is some clarity to that. It's like, okay, it's gone. I wrote it down. That's what I need to happen. And I'll keep writing it until it goes out of my vortex. And part of, the other thing is realizing that the discomfort is normal. And like I said last time, it was like sometimes you feel like you're walking around with no skin because you're dealing with very raw, real emotions. Sometimes it's difficult, and that is what you have to push through. And I do think that's the barrier for a lot of people. I've had people say, well, if I start crying, I'll never stop. So that's realizing the depths of their pain and their sorrow, and realizing that they're so afraid to let those emotions out because somehow they think they're controlling them by keeping them in. And what that's actually doing is controlling them. And that's the conundrum that one gets in, right? And so that is really the biggest thing to understand as part of a true therapeutic relationship. And it's okay to ask questions. It's okay to say, okay, so where are we going? That's, again, why I like my journals, because we have a structure for the session. We go through the journals. What was your daily thoughts? Where were you at? What's your gratitude now? What are you working towards? What's your therapy goals? What are we going to work on this week? What came up? What techniques do you need help with? What were your expectations versus where this is? And then, if you do, I usually say 6 months of weekly psychotherapy to get through the core, get through all your issues. It depends on how fast you work on your own, because the work that is done in psychotherapy isn't the 1 hour or 1.5 hours you're with me. It is the rest of the week, because now you have new ideas in your head. So now you will constantly be processing these things and saying, initially my favorite was when I was in psychotherapy, I said, well, that doesn't work. That's not me. That's not what I'm doing. That's not what I'm saying. And by my next session, I was like, damn it, she was right. That is what I'm doing. And that is how it's going. So you always kind of have to look at those expectations and say, okay, am I expecting that everything I say is just going to be perfect and this is all work out? No. Why? Because that's why you're there. You're there to get an educated perspective from somebody that has dealt with patients in all kinds of case scenarios for 25 years or whatever it is, and that's the reason, to have that, and understanding that therapy really is just a process. It's not about perfection. It's not about what you'll realize after doing psychotherapy is that your ideals for perfectionism go out the window because you know that that's not real. And then the best part of it is you know that that doesn't mean anything. That has nothing to do with you. The idea of you doing everything right is ludicrous. You doing everything correct every time it's unobtainable. And all it does is it creates stress and disharmony in your life. So being able to let go of that. And a lot of that goes through like cognitive behavioral therapy techniques, where you are paying attention to these thoughts. Sometimes we put rubber bands on people's hands, and every time you have that automatic thought, you snap it. And that just kind of gives you a quick reset of, no, that's not what's going on. I'm going to be okay. I'm going to go to bed tonight and leave the dishes. And that's not saying for people with OCD that, they can't ever not do that, but there's systematic desensitization. So there's other techniques that we use for an OCD or, somebody that has that problem or that propensity. And also, don't stay with your therapist. I don't even think you should stay with your therapist after the first session or the initial session. I do a 20-minute Zoom meeting. And I think in 20 minutes, you can figure out if we're going to mix or not. And if this is something that you would want. I think it's pretty clear. So always trust yourself. You trust your feelings, you trust your gut. The reason we trust our gut is because there's neurons in there. So the same neurons that are in your brain are in your gut. So you have all this neuronal activity down there. So when you think about how, like when you make decisions, you go, well, I can't make it because I had a gut decision. Of course you can. 100%. Your gut knows better than your brain. Why? Because your gut is going from that feeling state that something's not right. If you feel it's not right, it's not right. Your brain doesn't have to give you a list of reasons why it's not right. You already decided it's not right. And when we don't trust our instincts, that's when we always get in trouble. And I think most people think about that after the fact, right? You're like, you know what? I kind of knew there was something off there. I didn't know what it was. So I didn't have anything cognitive to tell me that's what it was. So now I'm going to ignore it. No, your gut is 100% right because it's not filtering in anything else, right? I mean, that's the great thing. And I think, the fear and stigma of being in psychotherapy, you have to let go of that. If you're really going to do well in psychotherapy and you're really going to do all those things that, you want to get done, that you just can't have that mindset of, that you're in a judgmental position or that you're, not kind of getting what you want out of it. It's never going to work for you. So what's something you wish you had known before starting therapy? Let's normalize conversations. That's what we have to do, right? We have to normalize these things. And maybe you keep it to yourself. It's nobody's business what you're doing. And it's not like everybody in the world shares how they're keeping their mind straight. So a lot of people do now. I think it's more popular. And I think it's something that's doesn't have as much stigma. But I do think internally we feel stigma because instead of seeking psychotherapy to feel better, and not that we're, totally, depressed and you can't get out of bed and things like that, where you have an acute exacerbated depression or you've been hospitalized for depression because you had a break, those are different levels. But the idea that you want to better yourself, how should you ever feel bad about wanting to better, wanting to let go of what no longer serves you, release your past, release everything, get out of your hamster wheel and get in your lazy river and have this peaceful existence where this vortex that you have around you is impermeable. It's like, you can't get in. No, I'm not doing anxiety. I am not doing depression. I'm not doing any of that. I'm going to work my butt off every day, but let's not do this anymore. So that is, huge part of it is really defining and saying, I have the power to control things. I have the power to control my brain, and I have the power to control what I think and what I feel. And getting started on that and understanding that that's, really the key here. So in looking for a relationship, the fit has to be there. There's really nothing else in there that is as valuable as finding that one person that you truly connect to, that you can tell all of, the dirt. It's basically like the dirt. You get to release it. Because again, once you say it out loud, number one, you hear it. So then you're thinking, okay, I just said that. What does that really mean? And just tying together all of those things. What does this really mean? What is this really happening? What is really going on? And so tomorrow we'll explore the power of self-awareness and intelligence, emotional intelligence, and understanding how all those emotions transform your life, because they do, because those emotions come from your brain. And so if we can control the brain, we can control the emotions, which is kind of what we're thinking about. So thank you for tuning in. Whether you're looking for a therapist, you are a therapist, you remember that healing is the connection. Keep prioritizing your mental well-being, and I will see you tomorrow.